So first we have to kneel down by the side of a person and tilt the head end upward, downward and chin upward. Thereafter we have to open his face to see whether he is breathing normally or not. Sometimes what happens, in a person the respiratory tract may be blocked due to air vomiting or respiratory secretion. In that cases, we have to first remove the secretion in the airway by suction machine or any manual, any foreign particle or any vomitous material. We have to clear out the materials. After that, we have to assess whether he is breathing normally, he is responsive or not. The response of a person can be diagnosed by asking his name, naam kya hai? In case he is not able to utter his name, or on painful stimulus over the forehead or over the sternum, if the person does not respond, the person might need the CPR. So it has two components, major two components, the chest compression and the rescue breathing. So chest compression usually given by keeping palm of a dominant hand over the central part of the chest below the nipple, and after that another hand should support the first hand and the elbow should be straight. After that we have to start compressing, and the rate of compression of the chest should be at the rate of 100 to 120 per minute, and the number of chest compression in a single cycle is around 30, and the depth of the chest compression should be 2 inches in adult. So quick succession we have to compress the chest around 30 times and assess whether the patient is responding or not. And one crucial point, that in between compression we should allow the patient to raise his chest so that we allow him to breathe normally in between two compression. So one compression and allow him whether the chest is moving or not. So subsequent 30 compression, after that we have to assess whether he is breathing or responding normally or not. If he is not breathing, then we make an attempt by rescue breathing to elevate the chest and resume the function of his heart and lung. By him, we have to first pinch his nose, and after that open his mouth by lifting the chin, and by touching face to face we have to give two forceful expiration so that it can automatically lift his chest and may resume his vital function. By pinching his nose and touching his mouth and pushing to blow. Thereafter, if the patient after single CPR cycle does not respond or revive, then we have to resume the same thing in a second cycle, the same thing, and 30 compression followed by 2 rescue breathing. One important point in children. So children may not tolerate the compression of the two hands. So in that children we have to give compression by single hand, and in case of infant by only 2 fingers. This is the major difference. And in some cases after the CPR and in the rescue breathing the person might not revive. In that case it may be due to ventricular fibrillation or ventricular tachycardia. What happens? Normal in our heart, that is the SA node, synovial node, is responsible for monitoring or whole of the cardiac function. So in case there are sometimes multiple ectopic foci in the heart, which responsible for increasing the heart rate, sometimes 180 to 200 beats, and the impulse originate from the atrium, that is the supraventricular region. One case, that is the PSVT, paroxysmal supraventricular tachycardia. In that case, automatic external defibrillator machine is also available in some center. We have to put the chest pad of the machine over the chest, and as per the machine guidelines, we can give external shock. By providing external shock, before the application of the shock, we have to remove all the metal particles, jewelry from the chest and body of the patient, as this is electrical phenomenon. And what happens? By sudden external shocking, as heart is a cardiac component, it stoppage all of the cardiac external foci as well as the regular foci. Once all the foci become stopped, the major dominant SA node may try to resume the function of this heart. So the PSVT subsides and patient may revive. So this is in brief the CPR guidelines. So thank you viewers for patient share.